I'm Mrs. Princey, Associate Professor in Mental Health Nursing. So today I'm here with another topic, very interesting topic. So we have got many psychiatric disorders wherein the individual will not be able to express all his feelings. He will be withdrawn. He will not be, talking with the other individuals, or she will not be in a position to have a socialization or interact with other individuals. So we have got a therapy which will enable the client to improve his socialization process, and also he will be able to express, his feelings and put all his negative thoughts out of his mind. So one such therapy that we are using is as a treatment process is the recreational therapy. So the topic for today is the recreational therapy. So recreational therapy is otherwise called as the activity therapy. So you understand that when I say activity therapy or a recreation, it is going to include so many activities, okay, which the client will use it as a recreation process or as an entertainment. So through this recreation or through the activity, he will be able to express all his pent up feelings or thoughts, and he will be improving his socialization process, right? So that is about the recreation therapy. Let us see the definition of the recreation therapy. Recreation therapy is a form of the activity therapy which is mostly used in the psychiatric setting. It is a planned therapeutic activity which enables people with the limitations to engage themselves in certain recreational activities. Okay, so that is the definition or the meaning of the recreational activities. Moving on to the aims or the goal of recreation therapy. So the first goal is to encourage the socialization process. As I told you, the psychiatric disorder can be of an depression, or it can be of a stress, okay, or it can be any kind of a disorder which makes the person to get withdrawn socially. So recreational activities or the activity therapies will help the client to encourage his process of communication or the socialization. When he is involved in the various activities, he will interact with the other individuals. The second aim is to decrease the withdrawal tendencies. Now, what is these withdrawal tendencies? If you take a schizophrenic condition, or if you take any kind of depression or any other mood disorders, okay, so the person will withdraw himself from the society. Okay, there is a withdrawal tendency. He will not be interested to work in the group, or he will not be interested to engage himself in the group. So in those conditions, okay, it is going to improve the withdrawal tendencies, or we are going to make the patient to involve in various activities so that he will stop this withdrawal tendencies. The third aim is to provide the outlet of feelings. As I told you, the client may not be able to express his feelings. He may not be able to share all his thoughts or feelings or emotions. So, in those conditions, when you give a activity therapy or a recreation therapy, it gives him a chance for the outlet of his feelings, or to express his feelings or the emotions. So that is another important purpose or the aim of the recreational activity. The next aim is to promote the socially acceptable behavior. There are many conditions wherein the individual will show the behavior which cannot be accepted by the society. It can be in terms of alcohol dependence syndrome or any kind of drug abuse. Okay, so they may become aggressive. They may have this kind of a personality, so which is not socially acceptable. So what happens in a recreation therapy or activity therapy? They will be involved in the various group activities. They will learn the social skills. They will learn how to be in a group. So through this recreational activity, the person will exhibit, or he will learn certain skills which are acceptable by the society. So behavior modification can be promoted by the recreational therapy. The next aim is to develop the client's ability of talents, skills, as well as overall ability of the client. So he would have got so many skills within him, or he would have got so many talents which he has just hidden. Okay, he is not in a position, or is not motivated by himself to exhibit or to just flourish all his talents. So through the recreation therapy, we are going to plan the activities, okay, based on the interest of the client, wherein he can develop those skills, and he can show all his talents and the abilities, which is going to boost his self esteem as well as the confidence. The next aim is to increase the self confidence and also increase the feeling of self worth. Okay, there are conditions wherein the person becomes very low, right? Low self esteem, low confidence in terms of anxiety disorders or phobic disorders, or in case of depression. Okay, so any kind of a post traumatic stress disorder. All these conditions, what happens? The person becomes very low, he feels inferior, he feels the loss of worth. Okay, so in those conditions, when we involve the client in such kind of the activity therapy or a recreational therapy, it is going to give a chance for him to achieve certain things, to fulfill certain abilities, which is going to boost his self confidence, which is going to boost his feeling of self worth. Okay, the overall self concept of a person can be improved by the recreation therapy. Moving on to certain points that we have to keep in mind when we plan the recreation activity. So each client is different, even though they have the similar, the same disorders, they are diagnosed with the same disorders. Okay, each individual is different. The cause of the disorder is different, right? So we have to give a one-to-one therapy, or we have to give a one-to-one care to the client. So when we plan a recreational activity, you have to see to it that each and every member or each and every client is getting benefited of it. Okay, so let us see some points that we have to keep in mind when we plan a recreational activity. The first important point is to provide a non-demanding as well as non-threatening environment. So when we plan the recreational therapy or the activity therapy, we have to see to it that the environment is such that it should not impose so much of demands from the client, or we should not force the client to achieve certain things. Okay, we should not pressurize the client. The activity should be such planned that it should not bring or cause or impose any kind of a forceful demands from the patient. And also the environment should be non-threatening. Okay, there are some clients who are very much scared or who are very much anxious about the group. Okay, or they may be very much anxious about their confidence to do certain things. Okay, they may not be very positive about themselves. So in those situations, you have to see to it that the individual client is being assessed, and based on the condition of the client, based on the abilities of the client, you have to provide the environment which is non-threatening as well as non-demanding. The second important point is you provide the activities that are relaxing and without rigid guidelines and time frames. Okay, so when you plan the activities for the patients, you see to it that the activities are not having rigid guidelines. Okay, yes, of course, if you take any kind of a game or any kind of a activity or any kind of a recreational work, there is some guideline to be followed. But since they are clients or patients, you see to it that the guidelines what you give are not so much rigid. Some kind of a flexibility that you have to make in the guidelines, and also they are not time frame. Okay, so time frame in the sense, okay, if certain activity you give to the client, okay, so within this particular duration or within this particular timing, this activity has to be completed. So what is this time frame when you give to the client? Okay, it is like imposing a force, so it is like demanding from the client to complete the particular activity within the set duration, going to impose a stress or an anxiety in the client, which can worsen his condition. So always see to it that whatever activities you plan, it shouldn't have a rigid guidelines as well as the time frames. the activities should be such that it should provide some kind of a relaxation to the client. Okay, it should be in such a way that the client feels calm and pleasant after completing his particular activity. He feels refreshed, he feels very happy about it. Okay, so such kind of a activity should be given to the client. The next important point is you provide activities that are enjoyable as well as self-satisfying. Okay, so as I told you, whatever activities you give to the client, so before you even plan the activities, you need to understand what are the likes and dislikes of the patient, what are his interests, right? So based on the interest of the client, based on the abilities of the client, okay, you give or you plan the activities which should be enjoyable, okay, which the client has to enjoy, he has to feel the self satisfaction. Okay, so that is another point that you have to keep in mind. So these are some points that you have to know when you plan the recreational activity. Moving on to the types of recreational activities, you got various kinds, or we have got various types of the recreational activities. So number one is the motor form of the recreational activity. Again, if you take the motor form of recreational activity, as the name says, motor form is something which is related to the movement of the muscles, movement. Okay, so if you take the motor form of the activity, it is further classified into fundamental forms of activity and accessory forms of the activity. So what is the fundamental form of the activity? It includes certain sports, okay, games such as hockey, football. So such kind of games, when it is included as a recreation, it is called as the fundamental form of the motor type of the recreational activity. When it comes to the accessory form, okay, so accessory form is exemplified by certain activities like play activities and dancing. Okay, so that is called as accessory type of the recreational. The second type of the recreational activity is the sensory form. So as I say, the sensory form, it includes the more use of the senses, sense organs. It can be hearing or the visual. So through these senses, the person is getting a recreation. Okay, that is the sensory form of the recreational activity. So if you take, for example, the visual form of the recreational activity, it includes making the client to view a movie or a certain kind of a drama or a play, or making the client to visualize the motion pictures. So such kind of activity is the visual form. Again, if you take the auditory form of the recreational activity, it includes listening to certain music or listening to certain concert, okay, about a particular concert on a religious topic. So all these are the auditory forms of the recreational activity. The third type of the recreational activity is the intellectual forms. So when I say the intellectual forms, something related to higher mental functioning in terms of thinking, in terms of perception, in terms of concentrating on certain things or paying attention to certain things, right? So it includes the activities like reading, debating, involving in certain seminars. So all these are the intellectual forms of recreational activities. Let us see certain suggested activities for the various psychiatric disorders. Number one is for the anxiety disorders. So if there are clients with the anxiety disorders, what kind of a recreational activity can be given? So you can plan the activities like walking, jogging, and aerobic exercises. You can plan for non-competitive sports which provide the outlet of the anger. For example, like jogging, swimming, running. Okay, so all these activities you can plan for depression disorders. Moving on to manic disorders. So for manic disorders, again, you have to see to it that the patient should not get excited when he is involving in the recreational activities. So such kind of a game should be planned on one-to-one basis. Okay, individualized games. Okay, like badminton or playing with a ball. Okay, so such games which doesn't involve so much of letting out the energy and making them feel very much competitive, which is going to end up with the aggressive behavior. Okay, such kind of activity is planned for manic disorder. Moving to the schizophrenic disorder, what kind of a recreational activity we can plan? So if you take a paranoid type of a schizophrenic conditions, you know that they are into, the world of hallucination or the delusion. So such kind of a thought should be distracted. So we give certain activities wherein we are going to distract the process of, such thinking, like involving them in concentration activities, like it can be playing a chess or a puzzle. If you take a catatonic type of the schizophrenia, you're going to plan some activities which are going to bring about a social interaction, or it's going to bring about the realization of the self or the reality, like dancing or athletics. So such kind of a game can be planned for catatonic schizophrenic conditions. The next disorder is dementia. So, in dementia, there is a problem with the memory, impairment in the memory. So, you give the activities which is going to improve the memory of the client. For example, you give a concrete, repetitive activities of doing the crafts or projects which is going to breed the familiarization as well as the comfort. Okay, so such kind of the activities that you will plan for a client with dementia. The next one is for the childhood as well as adolescent disorders. So if there is a client who is, a child, so what kind of activity that you are going to plan? For children especially, you're going to give a one-to-one individualized care or a plan of recreational activities. So wherein you're going to plan some activities like painting, drawing, and storytelling. Okay, so such kind of activities you can involve a child. So if you take the adolescent group, again the adolescent have lot of energy within them. So that energy should be put out in a positive way. So you can involve the adolescent in group activities, okay, like various sports, playing football or group games, which is going to be an outlet of energy for the adolescent group of the clients. The next disorder is the mental retardation. So again, it's a disability based on the level of disability, based on the type of the mental retardation. You're going to plan the recreational activities. So it can be like walking, dancing, swimming, playing a ball. So such kind of the activities we can plan for a child with the mental retardation based on the type or based on the level of the retardation. So this is about the various activities that we can plan for various psychiatric disorders. So moving on to the role of nurse in the recreational therapy. What is our responsibility? The first thing is you encourage the client to communicate as well as express his feelings. So, the goal of the recreation therapy is to bring about socialization in case of the clients who are having withdrawal tendencies, right? So, you bring about or you encourage the client to express his thoughts, express his feelings, improve his communication and the interaction. So, that is the first thing that you're going to do. The second responsibility is when you plan a recreation activity, you have to keep in mind that the environment should be such that it should not be a non demanding and non threatening environment for the client, because he will not approach also. He may just restrict himself and not come forward for involving in various activities. The third thing is you have to provide the activities which are not having rigid guidelines or time frames. It should bring about a relaxation in the client. The next responsibility is to help the client to develop his talents, to develop certain skills, as well as to improve the ability. So always, try to give the encouragement to the client, identify his need, identify his talents, okay, and also give him the positive reinforcement whenever he does well, so that his abilities can be improvised and he feels the feeling of self-worth and self-confidence. The next very important responsibility is when the client is in the any kind of the activity. As a nurse, you should be a very vigilant observer. You have to observe the behavior of the client. Okay, it can be on one-to-one basis when the client is performing some kind of activity, or when he goes to a group, when he's involving in a group. Okay, how is his behavior? Okay, is there any kind of deviation in the behavior, or is there improvement in his behavior? So you have to be there constantly assessing the behavior of the client, which is in turn going to help us to plan the treatment for the client. And always provide activities which are going to be enjoyable from the client's end, and he should feel the self satisfaction. Okay, so these are some of the nurse's responsibility when you plan for a recreational therapy. So you understand that recreational therapy is one of the important treatment that we use in the mental health setting for treating the clients with various disorders. Okay, to make them engage, to make them express their feelings, to improve their communication skills, wherein their emotional or behavioral problems can be rectified, and we can reach out to the client so that they can function in an effective way. Right? So hope you all have understood the topic. Thank you.